What do you see that's driving this serious suspicion and doubt and fear? What's going on in our brains that makes us vulnerable? Vaccines are a victim of their own success, basically, right? Because they work so well to protect all diseases from occurring. People become a little complacent and say, well, I'm fine. Why do I need to get a vaccine? So they become more leery of the actual vaccine itself and the disease.
This is the Transformational Life Consulting Podcast with Deepa Grandon, MD, where Christians like you get the practical support and tools you need to build your spiritual, mental, and physical well-being, and to guide you on your journey to health and wholeness based on evidence-based science and God's Word. I am your host, Dr. Deepa Grandon.
Welcome back to another episode of Time to Transform. To our returning community, it's always a privilege to have you back in this space of growth. And if you're joining us for the very first time, a warm welcome. We are so glad you're here. So our podcast has a very simple goal, and that is to bring you insights that are not only meaningful, but something that you can immediately apply to your day-to-day life. Because we believe that true vitality isn't built on a single habit. It's really the result of intentionally evolving in your spiritual, mental, and physical well-being. All right, so today's topic, it actually sits at the very core of both public health and individual health. It is a little complex and it's very often misunderstood, and that's the relationship between vaccines and your immune system. So as you know, we're living in an era where there's a lot of information and unfortunately a lot of misinformation. And this misinformation can spread faster than any virus. So you can understand, I'm sure most of you have heard a little knowledge is a dangerous thing. I would add the wrong type of information is disastrous because it really dictates how people behave, how they approach information. So today we're going to go back to basics, okay? So we're going to really ground ourselves in the signs of how the body protects itself, why diseases we once thought were behind us are quietly reemerging now. And, we often take for granted that we don't live in a world that's defined by smallpox or polio, but what we don't always recognize is that our collective immune memory, meaning our immune system as a society, depends on ongoing vigilance. Okay. And what do I mean by that? So when we look at persisting diseases, even when there is widespread vaccination programs, pathogens like pertussis, influenza, they keep evolving or changing, right? And that's the reason why every year we have to develop a new influenza vaccine because the virus itself changes and we have to understand or even make a prediction of what that mutation is going to be. And then when we're talking about seeing things like the reemergence of measles since 2000, we've been seeing more and more cases. And that's actually a little bit more concerning because the recent modeling suggests that the significant probability of the measles not just reemerging, but reestablishing itself as an endemic disease in the United States. And that is going to continue if our current vaccination trends continue to drop. So in today's episode, we will try to translate this complex immunology into a language that, is practical, it's relevant, and then we'll explore different things. For instance, the body's security system. So we have something known as your innate and adaptive immune system. And these little parts of your immune system, which you can think of as little soldiers with different functions, they actually learn from vaccines on how to protect you from certain types of diseases without you having to get the disease in the first place. Other things we'll explore, what is a true allergy versus a side effect? Because a lot of times when people have a side effect, they just say, oh, it's an allergy and I should never get this vaccine again. So it's important that we understand the difference of that. And then for most of us, we might have heard about the egg allergy myth, right? And that long-standing concern. It's like no longer a true concern because the way modern evidence and the research that has gone into understanding it has actually now verified that egg allergy is no longer something we need to be taking into consideration, especially with the flu vaccine, because the amount is so minuscule, it does absolutely nothing to an egg allergic individual. And then we'll also touch on what's going to happen in the future, what kind of technology is evolving and helping our immune system. For instance, the technology like the mRNA that was used for the COVID-19 vaccine is now being applied to highly personalized cancer therapies. So this is going to be a very fascinating conversation, and I'm very honored to welcome Dr. Joyce Yu. So Dr. Yu is truly a leader in the field of immunology. She is an associate professor of pediatrics, and she's also the director of the food allergy program at Columbia University Irving Medical Center. Her background, it reflects both clinical excellence and a deep scientific expertise. She had her medical education in the Icahn School of Medicine at Mount Sinai. She did her residency at Northwestern Lurie's Children's Hospital and her fellowship at the Allergy and Immunology Department in Mount Sinai. So she's also done postdoctoral work that focuses on what's called toll-like receptor signaling and memory B cell development, which is a very important mechanism that underpins how vaccines create lasting immunity. So she's definitely a great person to shed more light into this topic. So Dr. Yu, she is a fellow of both the American College of Asthma, Allergy, Immunology and the American Academy of Asthma, Allergy and Immunology. She is the former president of the New York Allergy and Asthma Society and has held leadership roles within Clinical Immunology Society. So in other words, she's not just caring for patients, but she's helping shape the signs and guidelines that clinicians across the country rely on. So Dr. Yu, thank you so much for joining us today. So before we start, can you share a little bit about your background and what inspired you to pursue a career in allergy and immunology?
Oh, thank you for having me, and thank you for the lovely introduction. So, for me, I've always had an interest in immunology. Pretty much, I stepped into an immunology lab as a summer pre-college student. I worked on protein folding and in an immunology lab. And then throughout college, I also worked in other immunology labs. And then in medical school, I even took some time off to do research in a transplant immunology lab. So it became pretty evident to me over the years that the potential impact that the immune system has on our bodies and this whole diverse role that it has in interacting with all our different organ systems. And then ultimately, I did a rotation in clinical allergy immunology as a medical student at Mount Sinai. And so between that and having allergies myself, that pretty much clenched my interest in a career in allergy immunology.
Yeah, I mean, it's amazing how very early on you could identify that this is what you really wanted to do. And it's kind of amazing, right? That you yourself have allergies, so kind of like made you more interested. Like for me too, it's like my family history of chronic lifestyle disease made me want to become a lifestyle board certified physician. So, I mean, it's just interesting to see how people's experiences cause them to choose that profession as well.
Yeah,
So,
it's like full circle.
yeah, yeah. So,
Yeah.
so when we are actually talking about vaccines, what exactly are we trying to prevent, right? So the vaccines we know have wiped out some of the most deadliest diseases in history, like smallpox is gone, polio is almost completely gone. But which diseases are we still actively fighting today, even with the widespread vaccination programs? And as an immunologist, what would you want people to understand about what happens when you let your guard down?
Yeah, so that is the problem. So, there's these communicable infectious diseases that used to not be very prevalent in our population have really started coming back again. And the one you really mentioned, the most one that's in top of everyone's mind is measles. And having measles in and of itself is an infection that also puts people at a certain risk for other complications as well too. And by vaccinating someone to measles, you prevent those subsequent complications from occurring. Influenza, as you mentioned, it's an annual disease, but still, influenza in and of itself can be pretty deadly. Especially for patients or people who have underlying disorders such as or heart disorders or lung disorders. They could be more susceptible to complications for flu, right? Yes, pertussis is coming back. So a lot of these communicable diseases, smallpox, that really the main thing is they are very deadly. They kill people and they can wipe out communities, and so it's a very big problem. So really, why would we care? What would happen? Well, when we let our guard down, allow ourselves to be at risk for these potentially deadly communicable diseases. There'll be these severe global consequences, right? Including increased deaths from infection, obviously. It will put more strain on our healthcare systems, right? It'll wipe out or make our communities unstable, right? And, especially the problematic thing of all of this is that it could disproportionately affect these low, middle income countries. They're much even more than the US. So it has a pretty devastating effect on us if we don't have appropriate vaccination levels to prevent these diseases.
Yeah, and I think if anything that COVID has taught us is how small the world is, right? Like how quickly COVID just spread across the globe, starting in one country and then ending up in just about every other country. And so we tend to always think in this very siloed perspective, like, oh, this is my decision. This is my world. What I do, I decide for myself. And yet, when you're talking about vaccine health, it's so much more than that, like you had alluded to. We call it herd immunity because the more people that are vaccinated in that community, the more susceptible individuals are protected. And then even evaluations done of certain communities like the Native American, Native Alaskan communities where the vaccination rates are very low, the death rates are pretty high from these diseases. So you can actually see the consequences of low vaccination rates when you look at communities where the vaccination is already low. And so when you have the opportunity to protect your loved ones, protect the community you live in, I think that's not something we should take for granted, right?
Yes, helping you try to help yourself. You want to help not to just help yourself, you want to help your community, also help themselves as well, too, right? And like you mentioned, there will always be maybe certain communities where there may be low vaccination rates, but we have been indirectly helping them had we had very good vaccination rates around their communities, right? So unfortunately, since the general population, like you're saying, there's declining vaccine rates, we're starting to lose exactly the herd immunity, sort of the indirect immunity that we could have provided them, those communities with the low vaccine rates. Also, like you said, patients who maybe cannot get vaccinated, right? So they can't protect themselves, and we have to help protect them. So,
yeah. So your immune system has a memory, and that's really the whole idea behind vaccines. So as someone who's studied the immune system for a living, can you walk us through what's happening inside the body after a vaccine, and how does that compare to when you get sick?
So, vaccines, they contain small particles or small parts of these microbes that we're trying to protect ourselves against here. So by getting a vaccine, you're receiving a small parts, this microbe. It's usually, either from we call an attenuated viral, so like a virus that's not actively, that can't actively infect you, or maybe from a dead virus. But a part of the virus that's very important that tells you this is the particular virus or microbe that you're trying to protect against. And what happens is you get this vaccine and it teaches your body to recognize and fight that particular microbe without actually making you sick, okay? So these pieces of these microbes, they trigger your natural defenses. So if you ever get sick again, there's two things that can happen. Your body already knows how to precisely stop it, but also stop it quickly. So, and also in addition to that, your immune system starts developing this memory protection that can help protect you which can last for months or years or even a whole lifetime, depending on the vaccine. So essentially, the vaccines are training your body's defenses without you actually getting the disease, which is a very big benefit of the vaccines. You can never get a side effect, or you can never get a subsequent disease consequence from the vaccine, right? And so that's a very, very big benefit from those.
Yeah. I think people forget how the natural infections have an aftermath. For instance, since we were talking about measles, it affects the glands, and it can infect it can cause something called orchitis, where, especially in young boys, it can cause the glands to swell, get inflamed, and sometimes it can cause infertility. So it's important that people remember, and in older, like adolescents and adults, getting measles is actually dangerous if they end up with something called encephalitis, because there's long-term consequences to that, and sometimes even death.
Correct.
So it's not like it's without its risk, as much as people are like, oh, let's just do it the natural way. And like you pointed out, you're just using the necessary proteins to shake up that memory of your immunity. And also, I've heard people say, oh, if I got the vaccine, why am I getting sick again? The intensity of the infection is reduced, and the major side effects that can happen to a first time exposure versus being exposed through the vaccine, building the memory, and then being exposed to the inciting infection reduces how your body, responds. And one of the things we noticed with the COVID, it caused something known as a systemic inflammatory response, which was what was killing people. Because it had such a severe immune response, it was completely destroying the body. And with the help of having a vaccine in place, it reduces that really robust immune inflammatory process. So I think there's so much to be said about the secondary nature. Like if you're already in your immune system's primed to recognize this virus, then when it's re-exposed, it's not like going crazy and, destroying organs in your body.
Correct. It's almost as if, when we had exactly the systemic inflammatory response, was it not just an abnormal response? It was like a normal response that actually caused more damage than potentially the initial infection in and of itself. Correct. So that was not a very good consequence of COVID in some patients, as you mentioned. And I actually, for example, I tell my patients, especially when it comes to measles and chickenpox, we vaccinate for measles and we vaccinate for chickenpox. So those people who get the vaccine are less likely to get the actual virus. What's the problem with the viruses? Well, because they go into your neurons, right? They go in those little and the neurons, and they basically go dormant, right? And so if you were vaccinated, you will not get the actual infection, and you will never get the virus in your system to go dormant and sit there for years and years and years. If you got the infection, unfortunately, you will get the virus into your system. And then, as you mentioned, in a number of cases of measles, you get this disease subsequent down the road called SSPE, called the subacute sclerosing panencephalitis. And so there are reports that we are seeing increased numbers of patients with this. And actually, I do have an anecdote on this. So I think I was in resident in medical school, actually. We had a child who came in. So he was 11 years. I'm very excited. He was 11 years old. He came in. He had this unknown neurologic disorder. His spinal fluid was very abnormal. Had lots of protein inside of it. We weren't sure what was going on. We thought it was maybe this thing called multiple sclerosis, but it was very strange. He's 11. So as it turns out, what had happened was he was 11 months old, and this is in New York City. At 11 months old, there was an outbreak of measles in New York around 1990. He was 11 months old at that time. He wasn't 1 year, so he did not get the measles vaccine, and he caught the measles disease. He recovered. He was fine. So now he's coming back to us 10 years later as an 11-year-old child and having this undiagnosed and unclear neurologic disorder. So as it turned out, we think probably that was a case of SSPE from his measles infection that he got at 11 months. And that was a really telling case because it was a terrible case because to me, SSPE looks like a combination of pretty much Alzheimer's and Parkinson's rolled into one. Very scary. And so he came into the hospital, and within 1 month, he went from talking, eating, and interacting with patients to pretty much not eating, not interacting, and pretty much bedbound. And unfortunately, he never left the hospital. So it was terrible, and exactly what you're saying, like, whereas right now we're these times, you would never think that you would ever see these kind of diseases, nor would you ever think you'd see subsequent sequelae of some of these diseases, right? So I tell my patients all the time, like, when you get the vaccine, you're guaranteed to not get the virus, or for example, specific measles. You're guaranteed to not have measles in your body, so you're guaranteed to never ever have the sequelae hanging over your head in your life. But if you get the disease, you could potentially have something, there's always a risk. And the same thing goes for chickenpox, right? So when you get chickenpox, we all got chickenpox as kids. But why do we vaccinate now? Because we know, as those of us who got chickenpox, we are more susceptible to getting shingles. And so, but why would we want to get shingles, right? So that was the point. I think the vaccine really helps, not just, like you're saying, this lessens the severity of the immune response to the disease, keeps you safe, but also reduces the risk for all these sequelae that could potentially have very devastating consequences.
Yeah. And I just wanted to clarify something because there is a difference, right? When you're talking about the measles, how it protects you versus influenza, because I've had patients always tell me, oh, I got the vaccine and I still got the virus. So it has to do with the mutation and how it's evolving. And I just wanted to stress that point, especially in our asthmatics. So both of us are allergist immunologists. We see some pretty severe asthmatics. And in those individuals who don't get their flu shot, the consequence of not getting it and the side effects of getting the actual virus is so much more dangerous. And if they were to get the vaccine and still have the virus, the manifestation is less intense.
Obviously, I agree for sure, 100%. Like the ones exactly like we were saying before, the patients who had the cardiac issues or the kidney problems or the lung problems, right? They're more susceptible to the secondary infections that you could get when you get flu. And correct, measles, I think the flu virus changes all the time. Measles is a different virus and doesn't necessarily change all the time here, but you do need a high vaccine coverage rate to keep everyone safe from measles.
Right, right. So that kind of is a good segue to our next questions because, measles was literally declared eliminated in the US in 2000 and now it's back. So what do you think is driving this and how many people actually need to be vaccinated to keep the rest of us safe?
So to keep measles under control requires approximately 95%, at minimum, a 95% vaccine coverage rate to prevent the outbreaks. And unfortunately, and as we saw in up to now, mid-2025, 2026, the vast majority of these cases are occurring in unvaccinated individuals. We've known, as you mentioned, this coverage rate has been decreasing in recent decades, at least in the last 20 years already. So in recent studies, coverage has been below 95%, and a vast majority of U.S. counties have been analyzed. So it's been contributed by declining vaccination rates and these a lot of personal belief or religious exemptions, and also all the disruptions that we've had from COVID-19 that definitely has accelerated some of this decreased vaccination rates.
Yeah. And I think measles is the one most people talk about, but there's also like Haemophilus influenza B that can cause encephalitis with serious consequences from that. Because I was listening to a talk recently by an infectious diseases physician from Vanderbilt, and he was talking about the outbreak in Disney. Measles is just so contagious. And while some kids can just get away with, a rash or a fever, the older kids are the ones we really worry about with the long-term consequences. And so, that 95% cutoff is so important. And like you were saying, that child who was 9 months old and wasn't at the age to get the vaccine because of how contagious measles was. There was a measles outbreak. The child who was susceptible got it. And that's where we always have to keep in mind the vaccination is not just for us, but for the susceptible ones in the community.
Absolutely, for sure. I think also I was talking to a colleague who's in Texas, and you mentioned pertussis. So there's a lot of concern now that pertussis is making a comeback. And I think exactly for most of us, when we were in training in medical school, that was not a common thing that we saw. So it's unfortunate that is also another one of those diseases that you think you should never ever see, but you are starting to see now. So
That's true.
sure.
So nobody likes getting a shot, right? Your arm hurts, you feel run down. So as an allergist, you're usually the one that, we get patients sent to us that because people have concerns about an allergic reaction. And we know that a lot of people can have side effects or what we call a normal immune response. That's where you have the fever, topical swelling, or the swelling where the injection's given. And sometimes it's misunderstood and said, oh, that's an allergic reaction. So can you help us differentiate what is an allergic reaction? What is an immune reaction? When does someone have to actually see the allergist immunologist?
Yeah, so we often can see mild symptoms after any vaccine, right? They can occur at any time, and like you mentioned, typical symptoms are sore arms or soreness at the injection site, maybe a low-grade fever, or you just feel warm, kind of feeling kind of fatigue. We call it there's a word called myalgia, so you have muscle aches. You just feel kind of lousy in general. That really is more a reflection of your immune system responding to the vaccine and building its response and building the memory, and actually tell people that's a good thing. So for many of us who don't have any symptoms after vaccination, you could almost argue, like, you wonder, am I responding? So for patients who have these symptoms, it is a clear cut in your face. You are clearly responding to the vaccine, right? So it's a good reassuring sign in certain ways, even though you may feel lousy. But these symptoms typically resolve after 1 or 3 days. You can take some Motrin, some Tylenol, and it's fluids, and you'll be fine again. And I would say this is normal. On the other hand, there can be potentially allergic type of reactions, and they involve a different part of the immune system. We often call it the hyperreactive or the overreactive part of the immune system, and that would be associated with a very specific constellation of symptoms, such as we call it anaphylaxis, or inflammation in the joints, or perhaps maybe abnormal effects of the liver. However, it should be noted that these types of reactions to vaccines are very rare, right? They occur approximately maybe 1 per million doses. And so the most, all these the vast majority of suspected allergic reactions to vaccines are really not confirmed upon formal allergy evaluation. And there's studies that show that up to 85% of patients or referred cases to allergists can safely continue or resume their vaccination schedule here. So, I think one of the key message from so these various guidelines, a take-home message for our patients or for anyone is that anyone who's had an apparent allergic reaction after vaccine should be evaluated by an allergist rather than just being told, to avoid future vaccines.
Yeah, absolutely. Yeah, unfortunately, that happens quite a lot. But they probably went to the ER or they saw their primary care physician and then they think they were told, oh, don't ever have this vaccine again. And that's, pretty much going to put that label on them. And then they are really fearful about taking any vaccine in the future. So I totally agree with that advice. It's so important that our primary care colleagues send us patients if they're not clear on whether the patient actually had an allergic reaction or not, so we can properly evaluate and make sure they're not having any false labeling. Yeah, and the other one that's very popular is I'm allergic to eggs, so I cannot get vaccinated, right? So a lot of people with food allergies, especially egg allergy, they've been told they cannot have certain vaccines. So Can you help us shed light about, especially with the latest technology and all the research that's been done in this area? And now we have also new concerns with ingredients like polyethylene glycol for the COVID vaccine. So, can you just help us understand a little bit about these ingredients and how much of a role do they actually play?
It used to be there was a egg derivative that was in the influenza vaccines, and there's some of the influenza vaccines may still have this derivative of ovalbumin in these vaccines. However, it's been shown time and time again over several studies now, probably in the past 5, 10 years, that egg allergy is not a contraindication of vaccines. And actually, it's been advised that healthcare professionals should not be asking this question as a screening question. So, in particular, it's not a contraindication for flu vaccines and the MMR vaccines. It's interesting because the MMR vaccine has been proven to have contain any egg substantive egg protein. Yet sometimes we still have primary care providers who still ask that question. So it's not recommended, no special precautions beyond normal recommended precautions where any vaccines are really necessary for patients with egg allergy of any severity here. The one possible exception is the yellow fever vaccine. However, the recommendations is not a hard no, but really is to take precautions, perhaps be evaluated by allergists, and maybe take some precautions with administering the vaccine, but to not necessarily avoid it. Okay, so I think so that's the first thing for the egg allergy. During COVID, so as we know, this new platform, the mRNA vaccines, were developed, and so there was some concern that these vaccines who are containing these potential excipient allergens like the polyethylene glycol and the polysorbate, they thought perhaps that these may be responsible for some of the adverse effects. I would use the word adverse effects of these COVID vaccines. But most people who had immediate reactions to first dose of these mRNA vaccines actually went on to receive subsequent doses without any issues. So it's not clear, excipients there are excipients in all vaccines here. And yes, you can sometimes have adverse effects from vaccines, but it may not necessarily be what you think is causing the adverse effect, right? So many of these recommendations state that in most cases, an allergy to a vaccine constituent is not necessarily a contraindication to the vaccine containing it. And as you mentioned, I think if you're not sure, if you have any questions about whether if you think you had a reaction to the vaccine and you're not clear what part of the vaccine you react to, it would be helpful to perhaps look ask for an allergist or go to your primary care doctor and have a discussion with them about that.
Yeah, I actually participated in a study that we looked at adverse events to the COVID vaccine. And for the ones that had the questionable history, we even did graded challenges on them. With the increasing dose, we started at a very, very small dose, gradually increase, and we had zero reactions. I've also seen that with the yellow fever, because again, the yellow fever is only if you're traveling to a certain country in South America mainly, or if you're living there, then it becomes, a question about the egg allergy. But the COVID vaccine was obviously way more widely used and had tons and tons of referrals for that. Mm-hmm. And then when you hear someone say, hey, doc, I got the vaccine and then I got really sick. And, it's just human nature. You're going to connect the dots and say, oh, it's the vaccine that made me sick. And with your background of being a physician scientist, how do you figure out whether a vaccine actually caused the illness or was it just bad timing?
That comes from one of the, this comes from my being experience as a pediatrician. So oftentimes, as we mentioned before, mild symptoms can occur with vaccines, and that can be reflective of your immune system reacting to the vaccine, actually having an immune response, right? Like it's supposed to, that's normal. Oftentimes what happens is we are getting these vaccines, especially the flu vaccine, during the middle of cold and flu season. So the odds of you catching a cold or flu virus during this time is quite high. So I tell people that if you get sick with a head cold shortly after a vaccine, especially flu, for example, it's probably mostly a coincidence just because we're getting these vaccinations at the same time where there's a high rate of these viruses in circulation, right?
Yeah.
So we often tell patients, we have to avoid telling patients that, vaccines are completely safe. But we should acknowledge that, yes, serious reactions can occur, but they're very, very rare. We're talking like, less than the 1 in 1 million. And often it's the same rare adverse events from the vaccine might often occur at a higher rate from the disease in and of itself. But yes, I think the vast majority of these adverse effects, and I like to use the word adverse effects because people sometimes say they equate the word reaction or allergy and reaction. They think is the same thing, right? So I tell people you can get reactions, like we just mentioned, but these reactions can be from your immune response to the vaccine, or you could have a reaction maybe to an excipient, or you can have a reaction to something else, basically here, or it could be just a coincidence. And so I think the vast majority, I think, is probably because you're getting the vaccine during the time when you're most likely to get sick, anyways. So,
Yeah, very true. That's a very good point. And then, there's something that's been puzzling, especially for me, because a lot of times I would think lack of information causes people to be very suspicious of certain types of treatment. But the vaccine hesitancy, it actually seems to directly correlate with education level. Like highly educated people are also very hesitant. And that's where I think that piece on misinformation, where exactly are they getting their information from, that it's concerning to me. So, in your practice, Dr. Yu, what do you see that's driving this serious suspicion and doubt and fear? What's going on in our brains that makes us vulnerable, even when there's like decades of evidence clearly showing the benefits of vaccination?
yeah, it's very unfortunate for vaccines because they work so well. And I think someone even said that vaccines are a victim of their own success, basically, right? Because they work so well to protect they have done well to protect our diseases from occurring. So people become a little complacent and say, well, I'm fine. Why do I need to get a vaccine? So they become more leery of the actual vaccine itself and the disease, right? And I think it's a combination. It's very this complex interplay of these psychological, the social cultural, the political, and historical factors that all come together to have people start doubting the vaccination. Then it gets, it becomes exactly when they use vaccinations, for example, like for political reasons and things like that, it gets very tricky, right? It's hard to kind of tease out what's actual science and what's actual facts versus what is actually someone's using the information to their own benefit. And oftentimes, these ideas or perceptions, they seem logical to the patient, right? This is what you're saying, like the very well educated patient, they think about this and they it seems very logical. That's why they're very persistent and say, I believe this, right? Um, in addition, all the inequities between communities and between countries, they can contribute to different attitudes and different beliefs. And we saw this a lot, for example, during COVID, right? And so, if, for example, I think there was an example of how certain countries got certain vaccines and other countries got other vaccines, and they saw differences in response to the vaccines, and so, for example, the mRNA versus those other vaccinations that were out there. And then finally, I think social media. I think our own our communities, the people in our community, social media, it's really played a role in misinformation. We have people who are not necessarily who have medical expertise, who are often who have a thought. Like I said, to them it feels very logical, and these are often people who are seeking to validate their own logic, validate their own concerns, and so they speak out on social media, and it really plays a role into this misinformation about the vaccinations.
Yeah. So I think like some of the research has been done. They looked at the cognitive biases that are contributing to the vaccine hesitancy. And I think a lot of it points to more intuitive type of reasoning or thinking as opposed to analytical, meaning they just intuitively believe that this is going to be harmful as opposed to just looking at the evidence itself. Um, and for some individuals, when they already have an underlying, say, anxiety, depression, factor in their system, it's really hard for them to differentiate analytically the information they're getting. Is this really true? Is this not true? Is this what's causing this outcome versus not? It makes it very gray and much harder to clearly delineate what they're actually reading versus is this true reality. So I think there's a mixture of different things that we're seeing that's promoting all of these cognitive biases in society. And then when we look at formal allergy workup, for instance, skin prick testing, a lot of these patients that claim, and I can tell you the majority, because I'm an internal medicine allergy immunology physician, majority of my patients with this significant fear tend to be female. And anytime I work them up, do skin prick tests, they're like pretty much 8 out of 10, 9 out of 10 times they're negative. And then 85% of these then go to get vaccinated because they agree to and they like tolerate it just fine. So it's really eye-opening to see how the information that's out there has an impact on us as a society. And also the whole reason why I'm having this podcast is because I want to bring in people like you, people like me. We've been educated in immunology. We see this in real time, and then just put our 2 cents worth out there. So for those who are sitting on the fence, at least they can take in more of that educated information and then decide for themselves how they want to live it out.
Agree. I think a lot of the, like you mentioned, a lot of these patients who are female, a lot of patients who often have multiple medical issues, right? So they have complex medical problems that they may not be able to get to the bottom of, and they're trying. So they spend their lives. It's unfortunate, right? They spend their lives trying to understand or trying to get to the bottom of why do I have what I have, and so I think they go down this rabbit hole, right? Of trying to find explanations. And oftentimes, like you said, when we end up oftentimes send objective testing, it's very hard to prove some of these theories or some of these things that to the patient still seems very logical, right? So, but yes.
Yeah. And then when a patient walks into your office and says, you know what, I'm really not sure about this vaccine. I'm so worried about a reaction. What do you say? Because, just beating them on the head with information never works. What is a good approach in helping someone who's so fearful?
Yeah, and it's actually, as a pediatric allergist, immunologist, you're working with not just the patient, the parents, right?
Yeah.
And and it relates to the previous question. These parents, they're here to they're helping their child. They really want to do the best for their child, right?
Yeah.
And so you just can't tell them, oh, what you want is it's the wrong thing. They really have very good intentions. So it's really important to first acknowledge that they have these concerns, but try not to acknowledge the specific concerns that they have, right? So, and it's very important to be very direct with the information that you're providing. Like you were saying, very direct, objective, validate information, and then tailoring your message to those specific concerns. Because if they're worried about one aspect of the vaccine, but you're talking about something else, that message will not get across to them. So motivational interviewing, building trust with the patients, understanding their specific concerns, giving that specific tailored information, and then finally respecting their autonomy, right? Like they're the ones who are going to have to make the decision, right? There are ways to kind of help discuss vaccines with their patients, So, so for example, I think the AP recommends this kind of presumptive approach, like your child is due for vaccines today. So that's this initial strategy here, right? So from the allergy perspective, our National Allergy Societies emphasize that the goal should be for patients to receive a recommended vaccines whenever possible. And that the role for us as allergists, we can help by listening and addressing the specific concerns, the individual concerns about the risk of vaccination, rather than just dismissing them. So I think it's very important to kind of really listen to what it is that they're concerned about. And also, I think one other thing we're talking about is that it's also sometimes good to give them like personal anecdotal stories as well too. So, for example, this thing with the measles, I actually had a conversation, a very difficult conversation with one family. This was years ago. Their child had received the vaccine. They thought the child actually ended up having, I think it's like a seizure disorder, so on and so forth afterwards. And they were very worried that this was a sequelae of the vaccine. And so I was telling them, I was like, no, but listening to what their concerns are. I also told them, like, well, these other stories. Now I gave them kind of like a very specific story. Like, so this is why I am an advocate for vaccinations. But again, the most important thing is to respect their autonomy. So,
Yeah. And I think you said something very important. Don't dismiss them. Um, I think as providers, sometimes we live in this world where we're surrounded by all this information, and most people are not. And most people come from a very different reality. They see different things. And I think it's really important for us to take the time to see things from their point of view. Um, and usually there is a reason when they are so passionately against anything, that there is an underlying reason in their minds that is so strong and so real, that taking the time to understand, building that relationship with them is going to be crucial in helping them overcome their own biases or whatever it might be in their minds that's holding them back. So that's actually such a good point that you made.
great.
Yeah. And then if vaccines could do more than just prevent infections, what if they could treat cancer? Because now we're hearing more and more, thanks to the technology that was used for the COVID vaccine, the mRNA, we're now able to personalize immunizations for specific tumors. So can you tell us a little bit about that type of technology and where we are headed?
Absolutely. So actually not so even before we get to the cancer topic, mRNA vaccines are currently being studied also for HIV, malaria, tuberculosis, so even other communicable diseases, right? So those have great potential. And as you mentioned, they're also being developed potentially to treat cancer, autoimmune conditions, and even neurodegenerative disorders. For example, there's currently active research on therapeutic applications for cancer prevention, cancer immunotherapy, as well as treatment of allergic diseases. So there have been over 120 of these clinical trials of these RNA-based cancer vaccines are currently underway. With the most advanced candidate is reducing the melanoma occurrence, which has been shown to reduce the melanoma occurrence about 44% compared to just immunotherapy by itself. So these personalized neoantigen vaccines that are specifically built for these target mutations that are unique to each patient's tumor have shown to stimulate very robust T cell responses, so our immune cell responses across different types of cancers, including melanoma, pancreatic cancer, and glioblastoma. So I think these new vaccine platforms, it's not just for additional infectious diseases, but they can be helpful for cancer, for other non-infectious disease disorders as well too. So lots of potential new purposes for these vaccines.
Yeah, definitely exciting times. Thank you, Dr. Yu. You've actually shared a lot of great information with us. Before we end, is there anything else you'd like to tell us?
I thank you for having me, but I'm glad we have this. You're doing this podcast because I agree with you. I think it's very important to get the message out there to our patients and our patients' providers and their doctors and their healthcare providers. I think it's important to get at least objective, direct information to kind of educate everyone on, first kind of this separating fact from fiction, basically. And hopefully that will overall improve our individual health and our community health. So,
yeah, for sure. Anyway, thanks again, Dr. Yu. It was wonderful having you, and thank you for your time.
Thank you.